Hi. Okay, this is such an important lesson. This is never taught in colleges, or maybe it was taught in your college, but most colleges it's not taught, and I have no idea why. Channel pathology. This is diagnosis according to Jing Lo, or in English, according to channel. So, how do you recognize a channel pattern in the body? You probably know by now how to recognize a Zong Fu pattern because most colleges are Zong Fu crazy. And sometimes that is the best way to go, but not always. So, a channel problem is considered an external problem. Okay, I don't mean exterior, like an EPI where you have fever and chills and superficial pulse. I mean external. It's on the external portion of the body, it's not deep in with the Zong and Fu. So it's considered external. It is often acute. Usually someone will come in and say, oh, I either had this trauma or I was doing something in the cold or I overused my wrist or something like this. And now I have this issue. I've got this shoulder pain all of a sudden, or I've got this rash on my arm or on my face. I've got this toothache all of a sudden. And you're going, okay, it looks like you're trying to figure out what happened here, like what happened 6 days ago when this came on. So oftentimes it's acute, not always, but usually. Another one is it's not directly related to any Zong or Fu pattern. Okay, so they might have all these patterns in their body, like most of us do after we're like 10 years old and we start creating imbalances. They might have patterns, but it's not related to their channel problem. Or, now I'm going to oppose that, they do have an organ problem, and now it's manifesting at the channel level. So those are your rules for figuring out if it's a channel pathology. Now let's look at some examples so we can bring this home. So let's say someone went on this great desert tour, very, very hot. They're from a cold environment. They flew there. They did this beautiful desert tour, had a great time, and they come back a few days later and they come into your clinic and they say, I have this giant rash on my arm right here. And you look into their symptoms and they seem to have no other symptoms. And they say, I have nothing. It was hot. There's no doubt about that. But it's a bit itchy. It's red. I feel fine other than that. So then you might say, okay, well, this must be a channel problem because it's not really related to any kind of Zong Fu patterns. So what probably happened here was a wind heat EPI. I'm not saying they have an EPI because remember that pathogens are still called EPI. The EPI heat has lodged in the channel area. It hasn't lodged in the way level. It's lodged in channel. So they would have wind heat in the heart channel. Very important to put that word in there because if you have heat in the heart, that means something completely different. Or let's do another example. We talked about it going from Zong to channel. So maybe they have anxiety for many years and tongue sores and speaking fast and tongue ulcers and racing mind and crazy dreams at night. And they've had this for years and years and years. And you go, okay, well, that is the pattern of heart fire. And then they come in and say, but lately I'm getting this red rash here. I can't seem to figure it out with the camera. There we go. I'm getting this red rash right here, and I don't know what it is, and I'm hot, and their face is red, and all these heart fire patterns. Then you can say, okay, well, this is heart fire, Zong pattern, heart fire, and now it's went up to the channel level. So it went from Zong to channel. So that would be called heart fire and heat in the heart channel. Okay, so there's another one. Another example might be someone who has, let's say, very weak qi and in an EPI is entered very easily. So perhaps it's a football player his whole life. Now he's 60 years old and he has his left knee as his bum knee because he had so many accidents and traumas on that knee. So what happens is locally that knee has been weakened. So now it's like he's a human barometer perhaps. And he says, oh, every time it's cold and rainy, my knee aches. I can feel it the day before. I should work for the Weather Network. And then you can say, okay, well, let's say it's medial knee. You can say, well, that is cold, damp in the spleen channel, and it has just a weakness underneath in the local channel. Or maybe they have weak body qi, the Gen qi. So maybe they have a lot of qi deficiency and yang deficiency and all these deficiency syndromes, and now they're getting this kind of cold, stiff neck every time it's cold out, and there's no reason for it. There's no traumas or anything like this. So you could say they have, let's say, I'll just give an example, spleen Qi deficiency and kidney Yang deficiency is their pattern, but they also have cold in the bladder channel, let's say. And it's just because their body Qi is weak, it can't, remember that Qi protects? Remember from our 5 functions of Qi? If you don't remember that, go back and watch that video. Because that Qi is weak, it's not protecting properly, and in the cold pathogen comes into the bladder channel. So that's called then the bladder channel cold. But this person would need to be tonified and warmed in their spleen and kidney, plus you need to scatter cold in the bladder channel and moxa. How do you treat a channel pathology? Well, usually you're going to choose a Jingwell or a Ying spring point. These are the points that are used to really drag energy out of a channel. And that's the fastest way too. You just want to be careful when someone's very weak inside, and that's the reason they have their channel pathology. Then you may want to tonify them and do a light draining. But for the most part, if it's a heat or a stasis, anything really excessive, or just a sharp cold, then you can just drain out. And you can add moxa if you need to. But there you go. There's channel pathology. Now, please look at your patients that way. I don't know why this isn't taught. And I will see you very soon.